Hello, welcome to my YouTube channel. In this episode, we will talk about trust in healthcare system and why is that important? Why trust is something we care and value. What are the outcomes associated with patient trust? And study I have read talks about this a lot. I read about outcomes of patient trust, and these are treatment adherence, patient satisfaction, and follow-up care, patient engaging with follow-up care. A lot of like these positive health related outcomes appear in trusted environment and if patients trust their doctors. And in these studies, which I'm going to write them down below this video in description area, we can say that there are two kinds of patient trust in healthcare system. These are interpersonal trust and another one is institutional trust. We will talk about this in a minute. Philosophers and historians talk about trust's meaning a lot. Meaning of trust or construct of trust entails optimistic acceptance vulnerable situation. For optimistic individual, you need a bright imagination of future. And for that, you need trust in community because you can imagine trust as a glue for people. Need for trust for any two individual necessitates a prediction future behavior together. And why is that important if you ask ourselves? Trust reduces complexity. Trust reduces complexity in society. And how can someone build trust? Trust building process is iterative process, often where there is a need for repeated evidence of responsibility, competency, and caring. These three components is very necessary for trust building process. And a minute earlier we talked about there is two kinds of trust. One of them interpersonal trust, and this is based on familiarity and previous encounters, personal history, really. And interpersonal trust positively related to subjective well-being and life satisfaction. In medical community, interpersonal trust is essential component of healthcare system, medical relationship, we can say. And this higher level of trust benefits both doctor and patient and healthcare system really. Higher patient satisfaction with care, better adherence to provider recommendations. This is something we really want in a hospital. For example, patients who trust their physicians are more likely to return for follow-up care. And if their health declines, they are more likely to seek treatment sooner. Like a cancer patient, this is something very important. And patients with higher level of trust are more willing to disclose sensitive information to their doctors and are less likely to verify physicians' recommendations, reducing the cost associated with getting a second opinion from another doctor. There is another kind of trust. We talked about this earlier. Institutional trust. This is a collective trust. Reputation of collective institution is also paramount to evaluation of trust. As individuals wish to trust reputable sources for their protection, stability, and structure they provide. From an economic perspective, trust in healthcare system is also beneficial. As trust increases patient retention and referral rates, which increases revenues, continued trust in medical system helps elevate the risk, vulnerability, and uncertainty of medical care when there is a power differential and information asymmetry. And in our subject, we talk about trust and older patient. When I started to explore this subject and read about that, I saw that there are a lot of articles about older patients and their trust in physicians, This is becoming more important by time because of with increasing aging problems in societies, age-related increase in contact between individual and healthcare systems, it is important to consider the role of age in healthcare system, healthcare's trust, really. And if we look at age-related differences, we can see that older adults are more likely to prefer passive roles in decision making than younger adults. Age is variable with potential to influence the strength of these relations. Age is significantly important and related to both trust in physicians and trust in healthcare systems. One reason may be that older patients have had more time to build and strengthen trust-based relationships with their physicians and experience satisfaction through repeat encounters. Older patients who believe their physicians are more empathic during their interactions are more likely to trust their physicians and be more satisfied with the care they receive. Patients with higher level of trust in their physicians desire less autonomy over decision making and prefer a more passive role in decision making process during visit than patients with lower level of trust. And when we exploring this trust in patients, we can ask them who should make this decision because of this data. If we can trust patients with poor self-rated health were 4 times as likely to be hospitalized, and with participants who rated their health as poor having a mortality rate 8 times greater than those who rated their health as excellent. And we came up this data with asking patients with this question: how would you rate your health at the present time? This is a key question in study. Participants 45 years of age and older participants demonstrated in study stronger association between trust in physicians and hospital admissions. COVID-19 pandemic created obstacles for effective doctor and patient communication and led to some compromise in trust in doctors during this time. And COVID-19 diagnosis was also negatively related to trust in healthcare system because public discussions about adequacy of our healthcare system as it attempt to deal with COVID-19 crisis. This is likely amplified by social media that have promoted inaccurate information regarding the diseases and its treatment. This is sometimes called infodemic. Trust is essential for healthcare system, as we talked about this earlier. It provides increased motivation for patients to seek out care willingly when needed. In some studies, trust defined as parents' belief that the pediatric healthcare provider has their child's best interest in mind. Belief that the pediatric healthcare provider has their child's best interest in mind. Trust potentially may have implications for insurance companies, health insurance programs, and even hospitals in terms of managing costs by decreasing avoidable hospitalizations. And one of the studies defined these 5 steps for building trust. Key elements for creating trust between doctor and patients are: first, provide reassurance to patients. Second, tell patients it's okay to ask questions. Third, show patients their lab results and explain them. Fourth, avoid language and behaviors that are judgmental of patients. And fifth and last, ask patient what they want, treatment goals and preferences. Like if you want to choose as a doctor between two different label of medicine, Ask patients what is their choice. This is something small but can make a difference sort of situation. And when we look at this research and data, we see that there is a significant difference between new patients in their first appointment, first visit, and old patients coming to visit, which doctor and patient trust developed in time. And when they ask patients, are you trusting your doctor, in a subtle way, that are you trusting your doctor's opinions about your diseases, don't see very big difference between specialized between doctors. Much more they want is open communication and trust in their relationship with doctors. They are trusting their doctors doing best what can they do, but in some questions doctors make them in a situation that doctors make them uncomfortable with their position. Patients want to leave and don't want to come back that doctor again. This results in making the doctors with better communication skills and standard average knowledge of medicine in a better position in their healthcare system. So in this episode we talk about age related trust discussions, age related trust decisions, age related topics about trust and decision making processes, and how to build trust between doctors and patients. And this is the end of this video. See you in the next one. Have a nice day.